Welcome to A Healthy Curiosity, the podcast that explores what it takes to be well in a busy world with self-care strategies from Chinese medicine. I'm your host, Brody Welch, here to support you on your journey of health, happiness, and personal evolution. Welcome to today's show. I'm your host, Brody Welch, a licensed acupuncturist, certified herbalist, and holistic health coach. And with me today is Dr. Jessica Drummond, who is the founder and CEO of the Integrative Women's Health Institute, and who is just a really cool woman doing some really important work empowering women who struggle with pelvic health conditions. She's also passionate about educating and supporting clinicians confidently and safely using integrative tools to transform women's and pelvic healthcare. She's had over 2 decades of experience in women's and pelvic health as a physical therapist, functional nutritionist, plus owning a private women's health clinical nutrition and coaching practice. So she has a unique perspective on all of the options for pelvic pain management, hormone balance, preconception and fertility support, postpartum recovery, chronic pain, and fatigue management in active and athletic women. She is a force to be reckoned with, and I am honored to have her join me for a conversation today on A Healthy Curiosity. Dr. Jessica Drummond, welcome to the show.
Thank you so much. It's my pleasure to be here.
I'd love to know how you got your start working with women with pelvic pain.
Well, I originally started my practice in physical therapy in outpatient orthopedics, so working with orthopedic surgery, surgical injuries and issues and sports injuries, things like that. And I had a patient early on, maybe even my first year out of graduate school, who had a surgery on her shoulder. Well, she had a breast cancer surgery, which affected her shoulder. And I began to get interested in the orthopedic conditions related to women's health issues like cancer, breast cancer, pregnancy, things like that. And a few years later, I began to really just 100% transition my practice to working with almost exclusively women and pregnant women, postpartum women, and some men, but only those with pelvic health concerns. So pelvic pain, incontinence, things of that nature. And pelvic pain in particular was always one of the most challenging diagnostic issues and impairments to overcome. You know, pelvic pain has a lot of different sources and pain drivers, and some of them overlap. And sometimes, it's more reproductive, hormonal. Other times it's more muscles and joints and nerves. Other times it's related to bladder. Other times it's related to the soft tissue of the vulva. And many times women are struggling with a lot of these things at the same time. And so just over time, that was a big challenge in my practice. And so I deepened my skill set by recognizing that using nutrition to support hormonal health, which I personally did after the birth of my first daughter, started to open some doors around more comprehensive care for these really challenging cases.
First off, just the recognizing that pelvic pain comes in many shapes and sizes and many different origins, that it is, I think, really important for people to know. I know certainly as working with people in clinic that it can be something that people don't really want to talk about. It's, that it's sort of in that down there, like this is off limits, or this is like not something that like it can be a source of shame for people to talk about or just even acknowledge to themselves. And so it's the kind of thing that there's often, in my experience working with women, a lot of times like there's a layer of suffering in silence or in secrecy or feeling like that it's not something that they're going to talk about as readily as shoulder pain, for example, a lot of times. Do you find that that's true?
Oh, absolutely. And the data supports that as well, that in many cases, women don't even talk about it with their gynecologists. And a lot of times when they do, they're not offered very many solutions, and sometimes they're even sort of shamed for this, something like, oh, you have pain with sex? Oh, just have a glass of wine and try a new position, And so, yeah, there's a lot of silence around it. There's a lot of shame around it. And often, even when women do bring it up in a healthcare setting, they're not offered many choices. They're either traumatized or shamed even further, or they're just offered solutions like, oh, hormonal birth control, or we'll just kind of go in there and look and see if we can find anything laparoscopically, but without really a lot of skill around that. So there's not a depth of lifestyle medicine that's well understood in most traditional medicine practices that give women some tools for starting to unravel where their pain drivers are.
And recognizing that there are other options other than ones that might be the first that to come out of a doctor's mouth, right? Like I treat a lot of women for menstrual health issues, things like endometriosis or well, just pain with periods or that kind of thing is something that acupuncture and Chinese herbs can oftentimes make a massive difference in as little as a few months of especially taking blood moving herbs, this idea that there's stagnation in this area and that as we move that stagnation, whether that's, in Chinese medicine language, it's metaphors. It's like, well, we need to dispel cold, which makes which constricts the area, or we need to dispel chi stagnation that basically hanging out there, or anyway, just that we look through our diagnostic lens and there's quite a lot that we can do and we can get very specific about kind of like how the pain is presenting, what else is going along with it, whether there's symptoms in other systems of the body are going along with it. And a lot of times there's a lot that we can do. Whereas women, a lot of times, like I think especially with period pain, that can be, whether or not there's something like an ovarian cyst or a, uterine fibroid or endometriosis, like whether or not there's actual structural changes, plenty of women experience discomfort on a regular basis. And it's so normalized in our culture that like, oh yeah, well, I just take Advil or I just take Motrin or I just, these sort of like just, minimizing these things that happen on a regular basis for days at a time, or that recognizing that what's normal or common is not necessarily natural or necessary. And so that's usually like where I like to start the conversation of like, wow, even though you may have been habituating to this, there is actually more that we can do other than just mask a symptom a lot of times. What are the more common conditions that you find yourself treating in the realm of pelvic pain?
Well, endometriosis is probably the most common, but also bladder pain syndromes, vulvodynia, just general deep pelvic pain, which can be myofascial or musculoskeletal. So pelvic floor dysfunction can overlay any of these. Sometimes birth injuries, so episiotomy or tearing scars, C-sections. So it can be anything, and even things like, pelvic fractures.
So whether it's coming from an internal organ issue or whether it is a musculoskeletal thing, that we typically think of things on the front side of the body as more organ related, but yeah, there's plenty of muscles and nerves and fascia and things that can get bound up in there from very mechanical or physical issues. Also energetically, right? That's something that can manifest emotionally. I find a lot of times, especially people who have experienced trauma or who have spent a lot of time in like kind of survival mode, that a lot of times that tends to live in the sacrum and the pelvic floor and just in the lower body in general. And a lot of times working on that level can be an important component.
Absolutely. And, and bowel issues also come into play because the colon and rectum are so close. So we have a lot of constipation, IBS overlapping, and definitely I really see emotionally in my practice that the pelvis is often a sort of center of safety. So when women are not feeling safe, well supported, and that can mean a lot of different things: financially safe, safe in their relationships, safe in their ability to speak up and work, but also, true trauma. I mean, I think one thing that the Me Too movement has really shown me as a clinician is I knew that a lot of women had sexual assault, sexual trauma, sexual abuse in their background because of the work that I do. It's one of the most common predisposing factors. But I then learned just how widespread that is. I mean, even there was a study published about 2 years ago that something like 80% of all American physical therapists had been assaulted in some way at work. So people just walking around, your healthcare providers are experiencing trauma in their day-to-day lives. And I think certainly when there's sexual trauma involved, or abuse, both are really the same thing in that sense. You can see the symptoms showing up in the pelvis, but I think you see it anytime someone's just not feeling safe in their life. That's a place where energetically you can have some challenges.
I really appreciate you saying that because it really is, in this day and age, at least it's like we're something that we're talking about more, but the fact that it's still so ubiquitous and widespread is really a massive, both political and social and cultural, as well as health issue that we need to be talking about more. So you mentioned endometriosis and vulvodynia, and I'd love for you to delve a little bit deeper into those two conditions because, well, vulvodynia I think is maybe even a word that most people aren't familiar with, but that I know a lot. It can be a very widespread issue, and endometriosis is certainly so common that I think it bears delving into a bit more as well.
Absolutely. So I'll start with vulvodynia, although I would say that often these two show up together and they call it the terrible triplets when we also have bladder pain involved.
Oh, okay. I don't know that term.
So unfortunately, so they often present in the same woman, but I often do see them individually as well. So vulvodynia is a very specific pain in the vulvar vestibule, which is essentially, the vestibule is like the foyer of your vulva, if that makes sense. So the little bit of tissue between the vulvar lips and the labia majora, and then the vagina, which is of course the like tube of tissue that heads up towards the uterus. So there's a little bit of tissue kind of right at that opening of the vulvovaginal space. And we look at it kind of as a clock. If you have someone in a position, just like as if they were going to the gynecologist and their knees are up and you're kind of looking at their vulva, there's a clock right at the entry, or like, a circular opening. And there's very specific pain there that can be either unprovoked. So it can be there anytime or all the time, or it can be provoked where it's just painful to, for example, put in a tampon or have a gynecologic exam or have intercourse, penetrating intercourse, right kind of at insertion or at penetration. And that, interestingly, when I first began to treat vulvodynia, it's commonly overlapping with pelvic floor dysfunction. So the pelvic floor is a group of muscles. There's some very thin kind of superficial muscles, but then there's a hammock of relatively deeper muscles that start at the pubic bone in front and hold you up, hold all your pelvic organs up in a hammock shape from the pubic bone to the tailbone, and then out to the sides to the like sitting bones, the ischial tuberosities for the geeks here. And
there are plenty of them listening to the show,
including us, I think. So the big hammock of muscles is your pelvic floor muscles, and especially if the ones towards the back, so towards the sitting bones and the tailbone, are tense, there can be specific pain in that vulvar region. So in that case, and often in all cases of vulvodynia, having specific manual pelvic physical therapy is really helpful to kind of restoring blood flow, relaxing the muscle tension, and reducing the pain right there at the vulvovaginal opening. There is more to it than that, though, in the sense that sometimes that's not enough. I believe actually the vulvodynia is an autoimmune disease, or at least has some factors of autoimmune disease, because we published a few studies last year where we essentially considered that the pain related to vulvodynia had something to do with a dysbiosis and leaky gut, increased intestinal permeability. So as we optimized gut health, and don't forget that 80% of the immune system is integrated within the digestive system. So thus, as you improve digestive health, you often improve immune health. And especially as you improve the microbiome in both the gut and the vulvovaginal regions, you can improve the immune function and reduce inflammation, reduce some autoimmune factors. So one study was really just using an elimination diet. And this was a woman who was vegan. And so we had to be, it was a little bit complicated to create that food plan, but getting her digestive function improved, putting her on a really clean, nourishing, low inflammatory diet where she wasn't getting things that were inflaming her. And she was a vegan, so she was eating a lot of soy. When we took that out, that was a really big needle mover in terms of reducing her symptoms. And then shortly thereafter, I had a patient who had vulvodynia. And we often see clinically that vulvodynia will go into sort of a remission when someone is pregnant. And again, that to me is like, is there an autoimmune condition going on? Because sometimes in pregnancy, certain autoimmune conditions will quiet a little bit as the immune system is naturally quieted by the pregnancy so that the body doesn't reject the fetus. So during her pregnancy, we got really diligent and again, focused on gut healing and improving the microbiome. And I think we followed her for about 21 months postpartum and the vulvodynia never returned. Now, of course, she continued to eat really well and optimize her digestion and all of that. So there's definitely some kind of immune inflammatory factors involved in vulvodynia. There's very commonly myofascial factors around the pelvic floor tension. There are emotional factors. So considering how to create a life that feels more relaxed and comfortable and safe. And then, of course, dealing with any trauma from a psychosocial standpoint as necessary in your history. That's kind of the more comprehensive approach to vulvodynia that I often take compared to if otherwise, women go to their gynecologist and, they might give them a cream or see if they have a yeast infection. And women do sometimes have chronic yeast and BV and that can contribute, but sometimes they don't. Like it's not culturing for anything anymore, but they're just still sort of treated for that. But that doesn't really work. And I see that as almost a precursor to having vulvodynia is that you continue to get treated for things that aren't really there with antibiotics and antifungals and things like that.
Is it your contention that this could be an autoimmune thing even without, anything physical, quote unquote, going on?
You mean without any pelvic floor tension?
Yeah. Or is it a combination?
Yes. Because here's the thing, sometimes without doing pelvic physical therapy, with just doing the kind of functional nutrition approach, we can relieve the pain. So it's not always the case that there's pelvic floor tension that's a key driver. But what I would say is a lot of times by then a woman is probably at some point had some pelvic floor physical therapy, or at least she's recognizes that there's an impact between her pelvic muscle tension and her symptoms. So she's almost doing self rehab. She's sort of starting to understand how to relax her muscles. She may be doing a mindfulness practice. She might be just exercising more. So it may not be as targeted physical therapy, but I think, anytime there's an irritant, right? Like if you have, I don't know, even a chronic, let's say you have psoriasis or something in your skin of your shoulder or neck, you might also have myofascial pain because of how you hold that body part, in a way that's protective. Does that make sense?
Absolutely. Yeah. I see that all the time.
So I think these two things play off of each other. The immune component and the myofascial components play off each other, and both, certainly the pain symptom and potentially the response of the body, we can also kind of trace back to how comfortable and safe feeling is the brain, how low is the inflammation in the brain, how's the neurotransmitter environment in the brain, are they low in GABA, low in serotonin, low in precursors like amino acids, is there a lot of inflammation, is there a lot of sugar dysregulation, so is there anemia? Is the brain for some reason sending a signal of danger when it may not be necessary from a local tissue standpoint? Does that make sense?
It totally makes sense. And it sounds like you're suggesting that, so obviously cleaning up diet, making sure that inflammation is low, engendering that feeling of safety in our lives, doing mindfulness practices. You're alluding to these things that can be done without necessarily going into a doctor's office or a pelvic floor physical therapy office and doing something. I'm curious if there's anything else kind of in that vein that you recommend people, like, just like the equivalent of doing breast self exams, or like, is there just kind of like good self-care for pelvic floor practices that you think that you would like more women to know about?
That's a great question. I don't think anyone has ever asked me that before, but I love that. Yes, I think that there is a level of pelvic health literacy, for lack of a better word, that would be great for every woman to have.
Well, give us pelvic health 101. Like, what do you want
Yeah.
every woman to know about about what she could be doing for her pelvis?
Yeah, most of us really kind of ignore it completely unless there's even either like pain or we're like literally giving birth. Because I've worked with, tens of thousands of women with pelvic health conditions. And so many times, I'll meet a woman who's like in her 40s, she's had 3 kids, and she's never even like looked at her own vulva. She doesn't ever connect her brain to her pelvic floor. Like, she's not really thinking about contracting or relaxing the muscles of her pelvic floor, because you don't really have to. Unless there's a problem, right? You don't walk around like having to tense your pelvic floor in order to walk, right? But
Ideally, yes.
yeah, yeah, unless serious prolapse or something like that. So as an example, yesterday I was working with 2 women, each with vulvodynia, and one, and again, this is something that you may or may not be able to learn kind of on your own, doing it with at least a book or a pelvic PT would be optimal. There are 2 books. My friend and colleague Amy Stein has a book that kind of helps to introduce you to pelvic floor myofascial relaxation and what all the muscles are and where they are and how they can contract and things like that. And then Tammy Lynn Kent, who I haven't ever met in person, but is also a pelvic physical therapist. She talks more about kind of the energetic relationship that we could develop with our own pelvises, and to be able to help develop that sense of security and connection. So those 2 books are helpful. And in my book, we talk about the nutritional steps and mindfulness steps, things like that, like a step-by-step self-care that you can do. And then also helping you to find the right people to help you, navigate any pelvic pain. But I think that just, being able, so going back to these 2 patients, one had a lot of body awareness around her pelvic floor muscles when she was tightening them, when to relax them, if she touched one, how to relax it, where things are in space. You can take a mirror and look at the skin and make sure it's pink and not super red, and, know that there's a wide number of perfectly normal looking vulvas. Like, there's almost never a need to like have plastic surgery on your vulva, though sometimes that seems to be an increasing trend to make it look right. But
yet another thing that women are supposed to like optimize or perfect in this world that focuses on appearances as opposed to how we feel.
Yeah, which is really insane. I've seen literally tens of thousands of vulvas, and there's no way I could say like this one's better than that one. If they're functioning well, some lips are smaller, some are bigger, some are different one side to the other. It does not matter. It's all perfectly functional as long as it's healthy and feeling well. So I think that's a thing, that there's a very normal wide variety in kind of what people's vulvas look like. And I think that the body awareness to be able to actively utilize and actively relax the muscles of the pelvic floor, kind of being able to keep them connected to the brain, is really advantageous. Because the one woman who could do that, I could kind of send her home with a bunch of home relaxation exercises. She doesn't need to physically see me that often. The other one, we needed to find a pelvic PT in her area, which again is a good thing too, because working with someone to develop this literacy, I think, is a really nourishing space to be. I know you said we really focus here a lot on self-care, which I agree with. But I also think there's a skill that women need to know need to practice around going beyond self-care to opening themselves up to just receiving care.
Oh, absolutely. Absolutely. As much as I want to empower people to take care of themselves, it is not weakness to ask for help. And it is not something to be ashamed of to want to work with a professional, whether that's a coach or a therapist or a doctor of any stripe. It's really about feeling better and how we want to be experiencing our lives in our bodies. And a lot of times it's like that what you're talking about, like I would make the analogy to yoga class where, in yoga class, we're taught to do these postures and to kind of like develop the body mind connection by like yoga teachers will encourage us to be breathing into these different parts of our bodies or feeling an opening or an expansion or a softening or just encouraging us to be in our bodies in these different ways. But ultimately, like, you've got to be doing it safely. You've got to be doing it, you've got to know the basic shape of the pose, or you've got to have at least a sense of what that's like, or you're not likely to develop that internal relationship as quickly or as effectively. If you've got a healthy curiosity, you want to know how you can be doing right by your body and how to live a more mindful, streamlined life in accordance with your values. While I love that you tune into the show every week, are you taking action? If not, why not? Here are the top 3 roadblocks that could be holding you back. 1, thinking that knowing is doing. They're different things. Knowing the properties of herbs is different than actually taking them. Knowing how to change a habit is different than actually changing up your routine. Knowing is the first step, but the 2nd, 3rd, 4th, and 100th steps involve action. Number 2, thinking that because you're smart and used to being successful, that you need to do it all yourself. This one dogged me for years as an independent-minded overachiever. That is, until I realized that 1, I can't see my own blind spots, and 2, I don't know what I don't know. Now, I'd much rather work with a guide who can point out the shortcut for the path I want to travel rather than get lost in the woods alone. Not only is it way easier, but I'm more likely to show up for myself if I've told my coach or my mastermind partners what I'm trying to do. Reason number 3, thinking that you don't have the money. What we spend money on is a reflection of what we're prioritizing. Maybe it's time to prioritize you. I'm opening up my calendar for a handful of one-on-one coaching clients. I've helped thousands of women break up with stress, optimize their habits, mood, hormones, weight, and vitality with integrative body-mind tools from Chinese medicine, yoga, neuroscience, coaching, and ancient wisdom. Just as importantly, I pour my heart into each of my clients, and you will feel that love in every single interaction. If you're ready to feel more calm and confident in your own skin, start feeling younger every year, feeling like you're at the center of your own life rather than just getting through it, and feel loved and supported in the process, head over to the Work With Me page at brodywelch.com and apply to work with me one-on-one. That's Brody with an IE and Welch with a CH. Now back to the show.
Pelvic self-care is around feeling super comfortable with your body by being open to exploring it as young as possible before you get too many layers of shame, right? So sometimes we don't get that just in our childhood experience of just like head, shoulders, knees, and toes, right? But for people who do, I think there's a real gift there because you just own your pelvis as a whole part of your body. And I think that's really important because the pelvis is kind of like this bowl where so many different organ systems and physiologic systems and energetic systems come together. It's a really kind of keystone piece of your anatomy and physiology.
And it's your foundation, right?
Yeah.
It's physically, it is the basis of what holds up our spine, right? And what allows us to be in gravity. Energetically, if we're thinking about the chakra system, we've got first and second chakras in the pelvis, which have to do with survival and having enough, self-acceptance, the will to live, our creativity, our sense of what we want to engender, what we want to give birth to metaphorically in our lives. Yeah, that really a lot of liver energy in Chinese medicine, like liver and kidney, really. If kidney is about kind of like that which stores our fundamental life force and our essence and our uniqueness, but also our will. and our liver, which has to do with so kidney being the water element, and obviously kidney and bladder are the organs that relate to the water element. Bladder's right down there in the pelvis. And then the wood element, so you water a tree to make it grow. So we need a strong water element in order to have that upward, outward growth and creativity that we think about with trees, with bamboo, with liver gallbladder. And so, and in Chinese medicine, it's the liver blood that is said to be the blood of menstruation. And just as the kidney yin is the actual egg, it's like we need free flowing liver qi, which leads to free flowing liver blood, and liver blood that is that allows us to be supple and flexible, and and also to be able to adapt to change. It has everything to do with kind of liver gallbladder. So all of these energetics can find their way to the pelvis, in addition to the idea that I'll just throw in, because people who've been listening to the show for a while have probably heard me talk about dampness, which is that idea of residue or some things that the body doesn't quite know how to process that hangs out. And generally dampness, like fog, it seeps downward. And so typically, like, the dampness can be often, most common forms of dampness are either undigested emotions, but also undigested, like, foods and food additives that our body takes in and doesn't quite know what to make of, like anything artificial, anything that's hard to digest, or like that overwhelms our digestive fire, can hang out in the body as this residue, as this kind of sludge, which is heavy and turbid and tends to sink. And so women who have a lot of vaginal discharge, ovarian cysts, things that kind of like hang out and get stuck in the pelvis or in the daimai, the belt vessel, which is one of the horizontal meridians in Chinese medicine. These are things that we're often dealing with in the pelvis, and a lot of times needling, doing acupuncture just inside the pelvic bowl, kind of around the waist area, can be some of the most potent points. Like, people will often just like have intense emotional releases that can lead to physical releases of like having to pee, having diarrhea, having something be like purged from the system, which then a lot of times allows us to feel better. Or similarly, like that, doing things like castor oil packs or using essential oils on these areas to kind of increase the flow of energy to the body. And of course, anytime that we are mentally and with our intention tuning into an area of the body, we're inviting our body to these areas. I think about a woman I treated yesterday who was trying to meditate, do an embodied form of meditation, and noticing that her awareness was just bouncing away from the pelvic floor and from that sort of second chakra, lower dantian region, and that she was just having a hard time even getting her mind to go there. And it's like, well, that's where the work is, like just being able to invite your awareness and your attention to into this area, and to feel safe enough to allow that energy to go there, can free up the flow of qi, which can reduce levels of pain.
Yeah, definitely. I've definitely find that acupuncture is a great tool for optimizing kind of menstrual cycles. So getting people who have irregular cycles or heavy cycles, things like that, great success with collaborating with acupuncturists. When it comes to the pelvis, there's so much shame around asking for help. So there was a quote I saw on one of my colleagues' pages yesterday from a physician we work with. It said something to the effect of, if you have a finger injury and you go to the doctor, they treat your finger, right? But if you have pain in your vagina or your pelvis, they immediately start to say, oh, well, it must be emotional,
Yeah.
It's just like, no one's like, oh.
Right. Like there might be something that, like, let's investigate this. What is the cause here, as opposed to just writing it off as something, something energetic.
Exactly. And so I think the energetic piece is important, but we do have to be careful to overplay that, because a lot of times it's like, no. So going back to, we definitely in vulvodynia have a number of kind of pain drivers, a number of causes, microbial, yeast, healthy bacteria imbalances, dysbiotic imbalances, immune factors, pelvic floor dysfunction, and the brain related pain drivers. But those are all physiologic, and certainly can be weaved in with emotional, which is important because, as you said, there's a lot of shame, right? And it's sort of a chicken and egg, right? women are uncomfortable around their pelvises because since they got their periods from like day one, it's like, oh, okay, well, go to the nurse, or this is embarrassing, like, and it's supposed to be painful, as you said in the beginning, a real normalization of, oh yeah, well, if you get your period, you're going to be out for a couple of days. That's just how it works. Welcome to womanhood. It's not like people are like, oh, great, you got your period. Let's talk about the improved concentration you'll have during the follicular phase and how much energy you're going to get. It's all about like, it's too bad. Well, welcome to the next, 25 years of your life.
Right. Right. And that reframe is really important. And it is braided together, right? The emotional and the physical. And just like, I guess, like, just to clarify that, like, what I'm suggesting in terms of like people making friends with areas where there is pain, it's like, I mean, I've suffered from chronic low back pain since I was a teenager. And it's like, it's still, like, I'm not embarrassed about it. I don't have shame about my lower back, but it's still a place that it's hard to get my concentration to go because it doesn't feel safe. And it's like, it very much is, like I can point to all sorts of reasons why that might exist, but being able to bring my awareness to the area is going to increase the free flow of chi and help the body to enable healing to happen from whatever the primary driver of the pain has been in the past. I remember actually when I was getting some physical therapy, or getting some Rolfing for or structural integration, which is kind of not quite Rolfing, it's just Rolfing, connective tissue work, working on the fascia, but from a different system, not coined by Ida Rolf, but this in being in a different tradition. But my therapist had me sitting on a half foam roller. So it's basically like having this like soft-ish curved dome thing for my pelvic floor. And that was unbelievably painful. I was like, holy cow. I had no idea how much tension I was carrying in my pelvic floor until doing that exercise and then going, well, this is probably just like we would foam roll like basically any part of our body that, gets sore. It's like, yeah, like it's okay to contact these areas in a non-sexual way to get ourselves to, to just relax them, or to just make friends with what it's like to just bring awareness and attention.
Absolutely. Yeah, that's a great one. I use balls and things like that a lot. Even we can release the pelvic floor literally by sitting on two kind of thick magic markers inside the ischial tuberosities. And then, kind of depending on how hard the surfaces you're sitting on will be how much pressure.
You're talking about magic markers that are lying on the floor lengthwise, right?
Lengthwise,
not poking up into your pelvic floor.
No, it's hard to do this on audio. I need some props.
Absolutely. Well, we can all visualize the thick magic markers lying lengthwise.
Like train tracks aligned with inside your ischial tuberosities.
Nice. I.e. the bony things at the bottom of your hips that you sit
on. The sit bones. Yeah. So I want to go back to endometriosis.
Yeah, please. I was just about to ask you that.
Sure. And endometriosis is a unique disease process, and that I think really we still don't know completely what the underlying causes are, but there's definitely a genetic component, because so they've done studies where they look at endometriosis in fetuses that have died for some reason. It is found in 9% of female fetuses and about 10% of girls and women.
Oh, that's wild. So endometriosis, could you define it for those of people who may not know what it is?
Yeah, it's a disease essentially where there are lesions of tissue that's very similar to the tissue that's inside the uterus, although not exactly the same, but that tissue is deposited in other parts of the body, so outside of the uterus. So either on the outside of the uterus, on the ovaries, on the bowel, on anywhere in the pelvis. It can be in the diaphragm, it can be in the lung. So it's lesions of tissue that's similar to tissue inside the uterus, but living in lesions outside the uterus.
And it's wild that would show up in a fetus, right? Like that's really interesting.
There's definitely genetic factors. Usually symptoms in girls and women don't show up until they're closer to puberty. So girls who are maybe 6, 7, 8, 9 will start having like digestive things like IBS or cramps or something. It won't be like related immediately to sort of reproductive cycles, but as they're prepubescent but getting close to puberty, they might complain of digestive symptoms. And then often in teenagers, it's pelvic pain. So cramps, deep pelvic pain, but not always, usually not synchronous with the cycle. And then later, as the disease progresses, it can be just kind of chronic pain all the time in the pelvis, but it could also be more cyclical because these lesions have female hormone receptors on them. We used to think they were only fed by estrogen, sort of like an estrogenic cancer lesion, if that makes sense. So you've got estrogen receptors. But now there was a study out of Belgium that was published earlier this year or last year that when looking at these lesions, some have progesterone receptors, some have both estrogen and progesterone receptors, some have neither. So the hormonal influence that actually can make the disease process worse or more symptomatic is a little bit variable from person to person. And there's not a really easy way to find that. And it's not standard at this point for the doctors to really look at the pathology and see which lesions are kind of more hormonally sensitive to which hormones. Because even in the same woman, you could have two different kinds of lesions, which is why for some women, estrogen suppression therapy like hormonal birth control or other more intense medications is helpful, at least symptomatically for endometriosis, but it's not a long-term, it's not a cure for the disease. And it also makes it a little trickier even to address it from a functional nutrition standpoint, because usually, in the past, I would mostly think about, estrogen metabolism, supporting the liver, reducing estrogenic foods. But there is some variability in how people actually respond to that, because the hormonal response of endometriosis, I think, we're seeing is what more varied than we first thought. So there's a hormonal component, there's a genetic component, and there's also an immune inflammatory component, which is another thing that's well addressed with nutrition and physical therapy. Now, some women have endometriosis that is silent. They don't have any pain, and they may not know they even have endometriosis ever, or until they try to get pregnant. It's a very common cause of fertility challenges. So the younger endometriosis can be identified, the better. Now, unfortunately, at this point, the only way to truly diagnose endometriosis is to have a skilled excision surgeon assess surgically. It's a surgical diagnosis. And the earlier that someone, who, if we have a suspicion of endometriosis, can have a skilled excision surgeon really take a look and make a skilled diagnosis. And then if necessary, do an excision surgery, literally like cutting out those lesions, almost like you would think of cutting out a cancer tumor. And there are not nearly enough surgeons who are well trained in doing this, but those people exist, and there are ways to find them. But that really can make or break someone's long-term experience with endometriosis, their long-term fertility preservation, their symptoms. Now, it's not required to have surgery to kind of live with this disease with fewer symptoms, because the pictures are widely variable. Some people don't have really severe pain. Some people have no pain. Some people don't have fertility impacts. But what we do see is that younger women who get diagnosed when they're teens and have endometriosis surgery in their teens, they have less severe cases. And then, it doesn't progress so much, because especially if you're doing the nutrition piece and the physical therapy piece, then, that person can be healthier. It's not like if you have good excision surgery, most of the time the lesions don't just grow back. So it's not good. The stories that I hear of someone having 16 surgeries, that's just a very poorly managed case. That should not happen.
Yeah, that was my next question, is if it is proliferative tissue, won't it just continue to proliferate even after it's removed? But yeah, in the hands of the right surgical professional, that doesn't sound like
It
something to
doesn't generally
expect. Yeah.
happen.
Okay.
Yeah.
Good to
Now
know.
it can, and sometimes it even does. And sometimes they just miss some of it. I mean, there can be more widespread endometriosis than they maybe see in the first surgery. And in rare cases, it does grow back exactly where it was. But the surgery makes a huge difference in outcomes in endometriosis care. And then concurrently, what we can do from a nutrition and mindfulness, lifestyle medicine, physical therapy standpoint is some women choose not to have surgery, which again is perfectly reasonable. This isn't a life-threatening condition, but it is a quality of life-threatening condition, and it does increase risk of cancer. So it's very serious. But you can make a conscious, and well-informed decision not to have surgery for many reasons. Maybe you've already had children and your fertility wasn't affected. Maybe you're not interested in having children. Maybe your symptoms aren't so severe. Because symptomatically, we can often significantly reduce symptoms, pain, bowel issues, that sort of thing without surgery. And sometimes having surgery doesn't just remove the symptoms. So this is a thing that has to happen concurrently, because the pain drivers are not, it's not like the lesion is the only pain driver. There can be concurrent hernias, there could be gut dysbiosis, there could be constipation, there could be vulvar problems, pelvic floor dysfunction. All of these things can happen together. So just having surgery isn't this like magic wand cure all, and you can't cure the disease or remove the disease without surgery. But there's a lot we can do from a lifestyle medicine standpoint to either make the surgical outcomes better. So like if you think about someone who had a great skilled excision surgery, they went in when they were 17, 19, 25 years old. They had pelvic physical therapy before and after. They learned how to relax the muscles and strengthen them appropriately and stretch the muscles of the pelvic floor and the surrounding pelvic and hip muscles. And they're eating an anti-inflammatory diet, and they have a mindfulness practice, and they're going to come home to people who are going to be able to care for them post-op for a few weeks, and their work environment is supportive of them taking care of themselves. It's a whole different outcome than if someone just goes into surgery. They don't really get PT before or after. They're expected to go back to work in 2 weeks. They're eating McDonald's and hospital food. It's just, you can have the same surgery and have very different outcomes.
Yeah, it's very, very true. And anecdotally, it is the kind of thing that a lot of times acupuncture and Chinese herbs can do so much to help. I have seen it be absolutely transformative for women who have struggled with pain.
Yeah.
And in terms of, and it's not even the kind of thing that like you have to be on herbs all the time. Even just being able to move blood for a few months can have some pretty long lasting effects. And this is the kind of thing where like, I can't certainly claim to cure endometriosis or anything like that, but it's one of those things where if you know someone that has it who hasn't done acupuncture and herbs, that would be something that it's like one of those, give it a shot and see if it helps, because it is pretty non-invasive and can make a massive difference.
Yeah, I agree. And I think, with nutrition, we see the same thing. We see some really good results to symptoms. And I always counsel my patients that I strongly recommend that they have a good skilled excision assessment, because they might choose not to have the surgery, and we might be able to get rid of all of their symptoms through things like acupuncture and nutrition and herbs and physical therapy, but they'll have a much better chance of preserving their long-term fertility if they really know if they have endometriosis, they have a skilled diagnosis. And then if they have had appropriate surgery, the earlier, the better.
Great to know. We are running low on time here, and I understand that you have a free workshop for people to participate in, or for people to check out if they're interested. Could you tell us a little bit about that?
Yeah. So, as I said, I work with a lot of patients with chronic pelvic pain, and we have developed a program that aligns, similarly with the book, Nutrition for Relieving Pelvic Pain, to help you kind of step by step take a lot of those self-care steps to shift your food plan, to begin to implement some self-care strategies. And for women who have milder or more easily addressed pelvic pain conditions, and they can be even fairly severe conditions, but making some of these lifestyle changes can, even on your own, impact the symptoms. Period pain, painful sex, pelvic pain, vulvovaginal pain. We offer some really kind of step-by-step strategies for taking care of those things in your own way. And then if you do need more skilled medical or physical therapy or nutrition or acupuncture support, we're trying to help you find, how to build a good team, because some of these subspecialties are a little bit hard to find.
And yet so important, obviously. Yeah. Obviously, it is really outside the conversation that most people are able to have with the professionals that may be readily available in their area. So we'll make sure that we have a link to that in the show notes. And if people just want to get in touch with you, where would you suggest that they go?
Sure. The website is Integrative Women's Health Institute.com. And we offer a lot of training for women's health and wellness professionals. And I do still see patients once a week. And we have master coaches in our community that help clients for support with their own health self-care.
Dr. Jessica Drummond, thank you so much for your time and expertise today. Is there any particular last tip you'd like to leave with the women who might be listening to this show to encourage them to take care of themselves or their pelvis in particular?
Finding your own sense of space and safe space, and maybe surrounding yourself on a regular basis with the 1 to 2 people in your life that you really can be vulnerable with, is such a healing experience and such a pleasurable experience for life that I think really supports our health, no matter what we might be struggling with.
Wow, such an important reminder. Thank you so much for joining me for this conversation today.
Thanks so much for having me. It was my pleasure.
Thanks for listening today. For more episodes of A Healthy Curiosity, you can visit the iTunes store. If you appreciated today's show, please leave us a review. This helps other people to find the podcast. You could also head to brodywelch.com, where you can find free self-care resources, learn more about Chinese medicine, and let me know what you'd like to hear about on future episodes. I'd love to hear from you. Till next time, be good to yourself.